Doctor, when you're looking at India and what's happening there right now, the devastation we have seen, the pictures and the videos that have come across the world on it, do you think and believe that India as a country opened up way too fast?
It's a tough question to answer. There is a reason why they had to open up quickly because the cases went down so low. But I would say that it is very quick to open up to the public events. Yes, definitely yes.
Definitely. And then when we're looking at it, doctor, the government or people allowed for something like a Kumbh Mela to happen in India, which gathered millions of people. There were election rallies that had thousands and thousands of people. There was variant spreading as well across the country. Did you and other medical healthcare workers predict this? Did you see this coming?
So the way the India was doing really well, it was very, very low number of cases.
Right.
There were not many mutants at that time. And I think it went very fast. And these events were all planned, which were not supposed to happen. Just not only the rallies, it's like weddings and parties, and there's multiple religious events going on, and so a lot are going on because the COVID was very, very low. But unfortunately, none of them realized that we are very low in vaccination rate. So, and the mutant strain, which is very new, which is like a double and triple mutant strains, two strains, which are the ones which were like almost like 100 times infectious than the first original the strain. So it was like within just few days, like 1 week, we were watching it. Being in United States, we were watching it. Like every day, the numbers were like tripling and 10 times and 100 times. So when we saw that rate of cases, reported cases from 20,000 to 200,000, then AAPI, we thought this is not the way it should go. Like this is something wrong going on. And they were already like the rallies happened that week and everything what not to happen has happened. So unfortunately, we were not prepared for any disaster in India to face any kind of that. I know experts know that it should not happen, but it did happen. So now we are in this situation that we are facing this disaster now without having a disaster plan and preparation. And so when we saw those cases going from 20,000 to 200,000, then we realized that there's something going wrong. We should help India right now, ASAP. So that's how we said, like, okay, let's start something. They cannot face the disaster. So we have to help them right on the first day itself. We jumped in and started this fundraiser. So AAPI was the first organization which started the fundraiser for this disaster, to send the supplies, help, and whatever help we need, professional services. So that was where we try to contact the Indian embassy right away. And we said, what can we do? What can we do to India? They said, not yet. We did not get any instructions yet. So we had to wait another 3-4 days. And so because India was not even ready to take help from other countries at that moment, it was like a shock-like state, I guess. So they were not ready. And then we were the first ones to jump in, called our embassy and in DC. And so interestingly, one organization, which is a non-profit organization in the United States, which is Seva International,
Right.
they came and they just said, like, okay, so the need was oxygen at that moment. So oxygen was depleted completely, like people were dying with lack of oxygen. So then we thought, okay, this is what we should do. Let's send the concentrators now. So that's where we jumped in and we sent the first 1,000 in the first week of May. So and now as the situation is evolving, now the needs are growing and differing. Like now they need concentrators, they need ventilators, they need oxygen plants, and they need medical professional help and supplies, PPs. So the need is growing.
Right. Are you is AAPI itself working with the Indian government, doctor?
So we started this So we want to help with our doctors in India who want to serve India. So we thought we will do this telehealth services to India, but we came to know from our experts and our physicians that does Indian government give us some kind of medical legal liability coverage, and not all physicians are licensed to practice in India. We left India 20, 30, 40 years ago, so we
Right.
had those original registrations which were there, so they are not active now. So we sent letters to our health minister Harshvardhan ji, and so we haven't received any reply back yet, but still we want to help whatever way we can. So a lot of telehealth platforms came forward, and they have global liability insurance coverage. So the few of them I know, and so our physicians signed up to those telehealth platforms. Now we have like 5, 6, 7, 8. Every day we keep hearing a new platform we want to help. So there's a lot of help coming from these telehealth platforms.
Yeah.
And AAPI is also working. AAPI is a force of physicians, right? We are
Right.
all physicians. We have experts from different specialties. So we can give our expertise to India right now. So our physicians are very enthusiastic and very much motivated to help India with whatever specialty need they need. So we want the COVID to be managed at home before anyone goes to the hospital, so we don't have to waste those oxygen supplies. And
Right.
further, the hospitals are full already. So our physicians, we made a few WhatsApp groups where Indian physicians join, and so they are asking help and opinion, or any help they need, professional help, they are getting right away. And the other thing, the platforms are eglobaldoctors.com, which is working with the Indian government with a telehealth platform. We are waiting for a few more days to happen. Probably it may happen too. So with that, the principal scientific advisor, we have a bunch of Zoom meetings with eglobaldoctors.com founders and principal scientific advisors of the Indian Health and Stanford University Global Outreach Program professor and AAPI. So all four of us have done a couple of meetings, and we are discussing how we can do that. So hopefully by this week, maybe we will be able to render our services without any much further delays.
Wow, there is a lot of help being sent from here to India, and it's so important. Doctor, when you are discussing coronavirus and the impact on India with doctors there and healthcare staff there, what is their condition like? How are they doing, the whole healthcare system?
So it's very, very sad that the whole healthcare system is almost crashing,
Yeah.
and a lot of healthcare workers have, they also got COVID, and a few doctors died. Like one day, 40 doctors died just one day. And it's very sad to see our own colleagues dying in spite of having all the PPE because of the way the virus is. And unfortunately, India, the vaccination rate is really very, very low. And so it's 10%, maybe right now it is 15% right now. So API is trying to help India to get the vaccines. So we had multiple discussions with the government, US government, Biden government, to send vaccines to India. So US has 100 million AstraZeneca vaccines.
Yeah.
So we are asking to send at least 20 to 30 million to India so that we can prevent. This is the preventive part of it. We are simultaneously working on the immediate as well as the preventive part of it.
Right.
So to prevent further, damage, so we want these vaccines to go to India, and US government is very, very supportive to it. Hopefully in next few days, I think some of the vaccines will be going to India, AstraZeneca and a few Pfizer. So with the Pfizer, I think they have to work on the logistics, like the temperatures and also storage and all. Those are the logistics. It needs some time, but definitely probably in a week time, I think India should get a big bulk of vaccines from United States.
So is getting the vaccine, more people, inoculating a lot of Indians, the answer to what's happening in India? Because India today surpassed 25 million cases, and it's at 200 279,000 deaths. Experts are saying the real numbers are 5 to 10 times higher. How are you looking at this? Can vaccine really solve it when the cases are so high?
So there are two different things we have to think about it. So acute care and then the preventive care. So the acute part is we have to do what we have to do right now, like supplies, oxygen, PPE, medications. So these are the acute ones we have to. So the vaccines are for the longer term. Like so, suppose one dose of vaccine can start, they develop antibodies in 3 weeks or 4 weeks or 5 weeks or 6 weeks, depending on every patient. Every person is different, but the vaccines should start developing antibodies. So even if they get COVID, still the symptoms will be mild, so that way we can avoid further hospitalizations and deaths. So the deaths are what is reported in the media may not be accurate, because it may not reach the media sources yet what exactly the death rates is, but we see the how many bodies are being cremated every day. It's much higher than what it is really notified to the government. So maybe the government might be behind on the exact numbers, but probably in next couple of months you will know exactly how many deaths happen. So right now these numbers are definitely not accurate.
Right, and just looking at these numbers again, doctor, just yesterday or actually today here, India reported more than 4,300 cases. It actually reported its highest death toll in a single day.
Right.
When do we see this slow down? Because the cases are kind of coming down. That's what we're hearing from the metropolitan cities. But these death rates, these numbers that we hear every day are so large.
Right. So we are at the peak right now, but in next 2 weeks it will fall. So right now they have seen that it's not going up anymore now. So that's a good sign that now the cases are not going up. So we will start to see the fall. So by September, definitely there will be a big difference by September.
Right. Do you see India opening up? There are a lot of lockdowns happening right now. Would September or October see an opening of the country maybe?
I think it's too early to say anything based on the observation, daily death rates. It all depends on how many death rates and how many hospitalizations and so and so. So it's too early to say that you can open the country in October. We cannot say that, because this virus is different from the previous strains. This virus is very, very rapidly spreading virus. Yeah. So I think we need to be very cautious, because India is anticipating a third surge. So we don't want to see that third surge. So in order not to see that third surge, I think the vaccinations are definitely a must. So at least 50% of the country should get vaccination in next 1 month. Definitely, yes.
Let me ask you something, doctor. If India is not able to contain their cases and deaths for some reason, and we hope that doesn't happen, what's the worst case scenario? How will this impact us globally, and especially the ones in the United States, because this Indian variant of the virus is already here in many states?
Right. So we knew that if that strain comes into United States, it will definitely impact. But the confidence we have right now in United States is the vaccinations. So we have 35% are vaccinated in United States right now, and above 65, more than 80% are vaccinated. So the confidence is the vaccination will help us. So we don't see that kind of surge what is happening right now in India, because the difference is vaccination rate is high in United States versus in India. So there are some, parents came here from India and they brought the virus into the country, but they are quarantining. So the quarantine is a must, 10-day minimum quarantine. After they come to United States, they should self-quarantine at home. It is a I mean, nobody should tell us what to do now. Everybody knew a lot about COVID right now. So we all know that 10 days is the quarantine time for if you get exposed. So even though the testing was negative when they left India, when they came here, they got the symptoms of COVID, but they were at home, they're quarantining. So we did not see any acute or any increase in the cases in United States yet with this double mutant.
Wow. So are we kind of safe from it so far? And will remain safe from it, because the travel from India to the United States is banned basically. India is banned by many countries right now, is on red alert. How are you looking at this?
So I think safety is very important, and travel is the one which caused the global pandemic, right?
Right.
People are traveling, right? So travel takes you. So when I at in United States, if I receive my parents from India, first of all, I have to be vaccinated. So if I am not vaccinated, I have a very high chance to get this virus. And unfortunately, young people are dying with this mutant. So if we have in the family, young members in the family, if a parent comes from India, unknowingly they carried the virus, and it's going to affect our children or the younger ones in the family. So this is very, very important that travel should be restricted at this time when the surge is so high. And every family here who receives anyone from India, my personal opinion, they all have to be vaccinated. Vaccine is definitely helping. So 94% efficacy with Pfizer and the other one. So both the vaccines have shown 94% efficacy. So we are very confident that vaccine is very, very important for anyone. So I think it's the decision of the country, United States and India, when to start the travel and how to restrict the travel. What are the travel restrictions? You have a level 4, you have different levels of travel restrictions. I think strictly we have to follow those travel restrictions. Anyone coming from India, they are in the level 4, so orange level. So that's where we have to be very cautious. And I think CDC, they already knew this mutant is how it is, but the confidence, we lifted the mask mandatory now, right? So indoors also you can go without a mask if you are vaccinated. That is a condition. I hope the public understand that when they said the mask mandate is removed, it is for vaccinated people. So I think that part should be stressed more by the CDC and everyone. So whoever is vaccinated, they are more protected versus non-vaccinated.
Well, I'm glad you brought this up, because I had some questions about the United States and COVID here as well, Doctor. Big question again on this mask mandate. Do you think this could lead to more cases if these unvaccinated people are walking around maskless now because they don't have to wear it?
Right. So that's the catch. So if any unvaccinated person goes out without wearing a mask, they do have a high chance of getting COVID, whatever variant is rotating right now. So we are trying to protect. It's a shield for us. Vaccine is a shield for us. So if I don't put the shield on, so I cannot protect myself against these variants. So, and this virus is mutating very frequently and very often. So we don't know which mutant will be much, much higher virulent.
Right.
So we don't know which will be less virulent versus, really bad virulence. So it's hard to say, hard to estimate, So I think the best part from us is we have to wear mask until we get vaccinated, and we have antibodies. Like 3 or 4 weeks later we develop antibodies, so we need to do that. And we have to also educate. Education is very, very important.
Right.
So yeah, the community needs to be educated that wear masks and social distancing and crowded. So slowly we are releasing those restrictions, because based on the cases in United States, we are are very low right now. So we are doing very good actually.
Yeah.
So our vaccination is still not yet. So we are only 35% right now. So we have to reach at least 50% pretty soon. So, and I think by summer, with all these 12 plus year old teenagers getting vaccinated, I think we will achieve our goals by summer, end of summer. Yes.
But are you a little afraid, doctor, about what could happen in the fall? Last year we saw the same trend where things opened up in the summer, and right now reopenings are happening all across the country, including here in New York State, which was the epicenter. Is this happening too fast? Last year we saw in the summer things get better, and in the fall the cases start to go up, and so did the deaths. Are you worried that that will happen again?
We are not worried right now because what we saw in the spring, after the spring break, we did
Right.
not see the surge. So that gave the confidence actually. So the summer we are vaccinating even the children, right? So our vaccinated rate is going up. So I'm sure that this surges again, fourth or fifth surge will not happen in summer, post summer, and fall season. Yes,
Right.
definitely we are going in the right direction right now.
Oh, that's so good to hear. What is your take on domestic travel right now in the US?
May I have that question again?
Yeah, what's your take on domestic travel, especially by airplanes in the US right now?
Okay, so domestic travel. I travel a lot, so I do wear a mask. I think wearing mask we have to, because when we travel, especially in the flights, there may be people who are not vaccinated. So it's always nice to protect yourself and others. So I think when you are in the closed space, definitely we have to wear a mask. And for my own protection, I will wear a mask, and I also educate others to wear a mask when you are in a closed group. But I think, as per all these, so far travel has been happening in United States. People are traveling, but we have never seen any increase in cases because of travel. So I don't think that is a problem, because we were all wearing the masks mandatory, and they have very, very efficient evacuation system, and so we have not seen any increase in cases because of travel in United States so far. So that's a confidence. But now we do not have to wear the masks, but still hospitals, schools, and I don't know about the airline industry, we are all still following that mask mandatory.
I appreciate the positive news you're giving us. It's been quite a long time before we started hearing something good in this pandemic. My last question to you, Doctor, has to do with the fact that AAPI works so closely with the Indian American community and the entire South Asian community in this country. There's a lot of work that happens between the community and AAPI doctors. How would you like all of us to help you? How can the community help AAPI give help back to India?
That's a very, very good question. And yes, definitely communities coming together, we can fight this pandemic. So we all have to come together. So AAPI has a big strength. We are alumni of different states. We have alumni from all the 50 states in India. So we are well connected to our alumni chapters, and through which we can reach the communities. And also we are well connected to the Indian communities in our own towns. So right now we are trying to reach the Indian communities, and they are reaching us. It's a mutual thing going right now. I think this is helping us a lot to reach out to the Indian community. So if I have a community from Gujarat, it's very easy for me to reach the community of Gujarat, and vice versa. So they are approaching us and we are approaching them. So it's interesting that AAPI has stood really, it's a front line. It's in the front line right now to help. So any help from the communities, we accept donations, concentrators, ventilators, PPE supplies, and whatever we can. And our physicians are ready to give their professional services. So that's our part as professional organization. AAPI is a organization of, we have 80,000 plus physicians, but we are not connected to all 80,000 physicians, but through our chapters we are connected to them. So I think we can do a lot when we come together. The connectivity is what API needs, and we are looking for that connectivity with the communities. So I think in next 2 or 3 months, we are sure that we'll reach out to every community and our help will be gone. And we are very glad that we are able to do this service to India. We are
Yes.
giving back our services to India. That's
Well,
very, very good feel for us.